Hello and welcome to the Complete Health Podcast, the podcast that brings you a complete view of healthcare, exercise as medicine, and much more.
We're your hosts, Helen O'Leary and Reece Noble, both physiotherapists at Complete Physio and Pilates in London.
This is episode 16, a COVID special episode with respiratory physio Emily Lockwood. This is the first of our two-part COVID series with Emily, with episode 1 being aimed at COVID patients, but don't worry, it also has some great info for therapists who are caring for people who are post-COVID too.
Emily tells us exactly what a respiratory physio is. Then she speaks in depth about the effect COVID is having on the body and the importance of not pushing yourself too hard when returning to exercise post-COVID.
Hello and welcome everyone to the Complete Health Podcast. I'm your host, Reece Noble, and as always, I'm here with my wonderful co-host, Helen O'Leary. Hello, Helen. How are you?
Very good. How are you?
I'm quite good actually, trying to keep warm in this current London winter. And today we have a really special guest, and especially for the current times with what's going on around the world, we have Emily from Air Physio.
Hello.
Yes.
Hello.
I had a bit of a brain fart there.
You did really, didn't you?
I did. So for those of you that don't know, Helen and I work at Complete Physio and Pilates here in London, and Emily's one of the excellent renters that we have that works very, very closely with us at our Chelsea clinic, and she's a wealth of knowledge on all things respiratory physio. So we're going to dive into COVID at the moment, and we're going to go through 2 episodes with Em. The first one will be a real resource for patients, for people who have had COVID and are dealing with what comes afterwards. And then episode 2 with Em will cover, it'll be more for people like Helen and I who are therapists who might be treating people who have had COVID and the best way to guide them through their recovery. So first off, Em, thank you very much for joining us and giving up your time this evening. We do appreciate it.
Pleasure. Thanks for having me.
So to start off with, who is Emily? How did she become a respiratory physio? And really, what is a respiratory physio? We'd like to know.
Okay. So first off, I think like most people, I never wanted to be a respiratory physio when I was at uni. It was the last thing I wanted to do when I did my placements. I didn't particularly enjoy it. I thought, all respiratory physios do is deal with phlegm, and that's something that I'm not interested in at all. And I think it was only in my junior rotations, once I'd qualified, which for those of you who don't know, when you qualify as a physio, you're advised to do you're advised to get a job in areas of different physio, really, so that you rotate around all the different areas like neurology and pediatrics, and respiratory being one of them. So it was only during my first respiratory rotation as a junior physio that I really enjoyed doing it, and that was at the fabulous Royal Brompton Hospital up the road from the Chelsea clinic. And so it was the staff that I worked with there who really led to me wanting to pursue a career in respiratory physio, really. And I started there back in 2012, it was, so quite a while ago. And I've been there ever since. But it's only been in the last 4 years that I've set up private practice. So Air Physiotherapy was born back end of 2016, but really kicked off in 2017. And I started off on my own, going out and seeing patients at home, patients with mainly respiratory disease. So that can be conditions such as COPD or asthma or bronchiectasis, cystic fibrosis. You might have heard of some of those conditions.
Mm-hmm.
And I started doing that in my own time outside of my NHS work at the Brompton. And as time has gone on, the service has grown really on its own through interest from lots of consultants, not only at the Brompton, but in other areas or in other hospitals, in London, and now we've got a team of about, well, 2 more coming on board this month. We've got a team of 5 physios who do not only home visits, but we've got a couple of clinics, one at Complete Physio and Pilates in Chelsea, and one on Wimpole Street. And we're doing lots of virtual consultations like many other people at the moment as well. So we offer all kinds of different consultations and different services, which I think maybe we will talk in a little bit more detail about. But yeah, that's where we are at the moment.
So we're going to dive straight into the question that seems to be on every front page, every newspaper, everybody's lips at the moment. We're going to talk about COVID. So first question is quite a big one. So can you explain to us exactly what is COVID and what kind of physical effects that people might see if they've had it both long-term and short-term?
Yeah, so as everybody I'm sure is aware, COVID is a virus which is an airborne virus. So it is contracted through the nose, the mouth, it can actually enter through the eyes as well. And that's why there's so much focus really on people wearing masks at the moment to protect themselves from that virus being within the air.
Nice demonstration, Reece, as he puts on his visor.
Putting his visor on. And this virus we're still learning about really. And certainly I'm not going to tread on any doctor's toes or anything like that in terms of explaining the ins and outs of how that affects the respiratory system and the cardiac system on a pathological level, but things that I'm sure everybody has heard of in terms of the way that this will affect somebody is that in the kind of immediate term, when somebody gets COVID, the body will have an immune response to that virus. And what will happen is people might experience symptoms such as shortness of breath. They might feel incredibly fatigued. We're hearing that the symptoms are mimic what might feel like flu. So people might have like joint aches and pains. They might have a bit of a cough, and that cough is not normally a phlegmy cough. So in my day-to-day work, I deal with a lot of patients who have phlegmy coughs, but in this situation, patients aren't necessarily getting phlegmy coughs. And for me, the shortness of breath in particular and the fatigue has been a big problem for the patients that we're seeing in the longer term. And that kind of brings me on to the longer term symptoms and effects that this virus has, which again, we're learning about. But ultimately, the symptoms which are longer lasting, and when I'm saying longer lasting, people are kind of talking about long COVID being symptoms that persist after 12 weeks of the initial viral exposure. And typically these patients are experiencing long-term shortness of breath, decreased exercise tolerance, fatigue, sleep disturbance, brain fog, things like this. And again, we're learning about that as not only a profession from physios, but all the medical professionals. We're learning all over the world about how this is affecting people and how to manage it. So it's really an evolving situation and process.
Yeah, and how is it? I mean, you, especially early doors, I guess people were comparing it to the flu, just a regular flu. How does it seem to differ from that, and why is it having a different effect? Do we know?
Yeah, good question. I mean, I haven't had it. My dad actually had it over Christmas. It was a bit of a kick in the teeth. He got diagnosed with COVID, or he got his positive test back on Christmas Day. So
Christmas.
I know, such a bummer. So yeah, and actually kind of going off, I've been speaking to him, and I say keeping a close eye. I haven't seen him, but been keeping a close ear on him ever since. And the way that he's kind of described it, how it differs from any kind of flu illness that he's had before, is that So the taste is a big one, and I think you've probably heard a lot of people saying, well, you either lose your taste or you lose your sense of smell. He didn't lose his sense of taste, but he said that things tasted different. So he'd have a cup of tea and it wouldn't taste like a cup of tea, it would just taste a bit off. He
Hard
had
for an Englishman to deal with.
Yeah.
Being able to
I mean, I
taste
actually
tea.
don't like tea, so
Oh, blasphemy.
but
Mine.
yeah, he said it just didn't taste like tea. The joint pains and the aches, which you would normally get from flu, he said that were quite consistent with how he might have felt with a flu-like illness. But I think also the tight chestedness. So people are feeling a tight chest, they're having this irritable, dry cough, which again, you might not get with flu. So I think the main thing really that I'm saying to patients in terms of how it differs is the effect that it has on the respiratory system, because we know that this is a respiratory virus. So it's things like shortness of breath, tight chestedness, cough, those things that seem to differ from what I've heard from a normal flu-like illness.
And I think
sorry, go Helen, go.
So I think one of the things as well is like you say, Emily, we are learning about this all the time. So this maybe started to come into the press about a year ago. I mean, in the UK, we probably didn't really start talking about it till mid-Feb. So actually these kind of long COVID symptoms and how is it affecting people long-term and that sort of thing, we don't actually know the answers because we're still waiting for those first kind of group of people a year ago who got it to still sort of present and come through and see and how they've progressed or not progressed, or what they're still struggling with, what they got over really quickly and easily. So we're still trying to find out all of that as well, which I'm guessing makes your job quite difficult.
Yeah, definitely. And I think, I mean, even now I'm getting people come through who maybe had symptoms in March, April. So those are the you know, if we're saying where are we now, beginning of January, that's like a lag time of what, 9 months, 8 or 9 months for those patients to get to me. Now, in that time, there are some that will come through quicker, but in that time, majority of them have not only had COVID symptoms initially for the 2 weeks or the month or however long it took, they've then gone to maybe their GP 12 or 16 weeks later. They've then been through a battery of tests with respiratory consultants or cardiac consultants to rule out any underlying long-term conditions that they might have been left with, which then hopefully all those tests have been fine, so their heart and lungs are healthy, and then they end up coming to somebody like me. So yeah, there is a big lag between when somebody might have the virus to when they might be diagnosed with long COVID or come into contact with somebody like myself or one of my colleagues.
Just a bit of a question without notice, the smell and the taste aspect of it, do they know why?
I don't know. They might do, but I don't know the answer to that question, Reece.
Sorry, they being the medical establishment.
Yeah. Yeah. So some people may do, and some of my colleagues might know, but I don't know the answer to that question.
Yeah, I mean, I haven't heard anything about it.
No,
so.
no. I hope it doesn't last long term though.
I know, I was just suddenly thinking, what happens if I can't drink tea if I get it? I mean, oh my goodness.
Or not being able to taste. I mean, oh, it would just be terrible. So I really hope it doesn't. I mean, I think for some people it is lasting longer than just kind of the first few weeks. So I really hope that it comes back for them.
So I'm getting back into, obviously, for patients or for people who might be experiencing COVID symptoms, part of this obviously is the respiratory aspect of it, the shortness of breath and things like that. Is there things you're advising people to do while they have it to maintain their lung function or to keep their lungs, I guess, strong while they're experiencing these symptoms?
No, not necessarily. Certainly not in the acute phase. Now, back in March when we were all in lockdown and we were kind of hearing in the news and in the media about patients that were struggling with breathlessness at home. There was loads and loads of focus, I don't know whether you remember, but there was loads of focus on breathing exercises and people lying prone, and that means lying on your tummy and things like that. And there was quite a lot on social media that was shared of people demonstrating various different things. And there was a bit of a kind of uproar in the respiratory physio world, because we were kind of turning around and saying, hang on a sec, actually some of the things that are being recommended here are detrimental, or not necessarily detrimental, but they're only really applicable to certain cohorts of patients, maybe with lung disease, not applicable to healthy people who have got COVID. Now, I think the main thing for people to think about, if they have got COVID, they've got a positive test, and they've got respiratory symptoms. So here I'm talking about shortness of breath and cough. The main thing that people can try and do or be aware of is that we want that cough to stay dry. We don't really want it to become productive. If somebody has got an underlying lung condition, which means they have a normally day-to-day their cough is productive, so this is conditions like cystic fibrosis, bronchiectasis, some asthmatics end up with productive coughs at various times of the year, the best thing that they can do is keep their lungs clean and clear. So if they don't already have an airway clearance regime, so that's breathing exercises to keep their chest clear, provided by a respiratory physio, then they should get in touch with a respiratory physio or go via their GP to try and get in touch with one to make sure that they've got a regime in place to keep their chest clear. Now, the reason I'm saying that is because what you certainly don't want to get is a bacterial infection, so a bacterial chest infection on top of the virus, because that's going to impair your breathing even more and make your shortness of breath worse and potentially affect your oxygen levels. So that's one main thing I would advise. Again, for somebody who doesn't have underlying respiratory disease, if you're worried about the fact that you might have a chest infection on top, you need to be looking out for things like, are you coughing up phlegm that isn't normal for you? If you are coughing up phlegm, is it coloured? Because typically it should be clear or white. If it's yellow or green or brown, I know it sounds a bit crude, but if it's changing colour, then that's a sign as well that you might have a bacterial infection on top of this. So making sure that your chest is staying clear is really important. Other things that we're recommending, and this is something again which I don't know how I feel about it, and what I don't know how I feel about is monitoring of oxygen levels. So that is using it's called a pulse oximeter. So it's one of those little things that goes on the end of your finger and it measures your oxygen levels basically. And in a healthy person, your oxygen level should be 98 to 98 to 100%.
Well, there you go, Reece.
88, then call 999. They should be as close to 100% as possible, really, but anywhere kind of 98, 99, 100 is perfect. Mine is normally 90, 98, 97. So a lot of people are saying, get yourself a pulse oximeter. Now, I'm not necessarily recommending that to everybody. And when my dad had COVID, I didn't say, jump on Amazon and get yourself a pulse oximeter, because my fear is that it drives anxiety in a lot of patients when it's an anxious time for people anyway. And actually not everybody is getting the shortness of breath symptoms. If somebody that I'm therefore saying to people, okay, so if you are noticing that your fingers are feeling cold or they're looking blue, you're looking in the mirror and your lips are looking blue, or you're very pale, what that means is if your fingers are blue and your fingers are cold, is that you're not getting enough oxygen to the ends of your fingers. We call it cyanosis, and that can be a sign of low oxygen levels. Now, if that is happening, you would definitely need to have a medical opinion, and you would probably either have called 111 already, or they might have put you through to the emergency services. So if your breathing is really laboured, or you have got signs of cyanosis, then that is a reason why you would need a medical opinion. But in terms of kind of breathing exercises and things like that during the acute period, it's not necessarily something that is needed. It's, you know, let your body recover, loads and loads of rest, loads of hydration, eat as you can. I think people are losing their appetite, but, you know, eat as and when you can. Taking massive, great big deep breaths. I think a lot of people want to do that to check that they can get air into their lungs. There's no harm in doing that, but it's not necessarily going to improve your lung function per se. Yeah.
And you mentioned acute phase. So how long is the acute phase? So let's say you've got symptoms, you've got a test. By now we're probably looking at maybe 5 days before you've got your positive result. So how long is the acute phase lasting?
Yeah, I think ballpark it's about 2 to 3 weeks.
Okay.
Roughly. And again, that other people might say other things, but typically from what I've heard in terms of patients having those kind of earlier symptoms, they're tending to last about that long. And not everybody, I think it's important to say, not everybody will get the shortness of breath. You know, some people might get the shortness of breath, won't get the fatigue. Some people will get the shortness of breath, won't get the fatigue. So it's not a given that if you get COVID, oh my goodness, I'm not going to be able to catch my breath. So I think that's probably important to point out as well.
We had it went through my house. Well, we're very suspicious that it went through my house, in that basically 2 flats worth of people were all sick at the same time. And we played a bit of COVID bingo, where not all of us, we sort of ticked off all the symptoms between the 8 of us, but none of us had them all. So it was quite interesting just in that small space that I think 2 or 3 of us lost taste and smell. Others had fever, you know, aches, those types of things. So it was quite an interesting, just small case study, I guess, that highlights that point that not everyone's going to get the full array of symptoms.
So do you need to be, so Reece kind of spoke about exercises to maintain lung function. So if you have had a positive test and you have got that shortness of breath type chest, do you need to be worried about your lung function or what's happening there?
It depends again. So I think people will automatically be worried. Of course they're going to be. I think as soon as somebody gets a positive test, they'll probably be thinking, oh my goodness, you know, there's been loads in the media about long COVID. How long are my symptoms going to persist for? Does it mean that there's going to be a long-term effect to my lungs? The short answer is, for the majority of people, no, probably not. The only way somebody is going to know that for sure is whether they have lung function testing or whether they go and see a respiratory consultant. Now, that's only going to be indicated if somebody's symptoms are persisting. And by that, I mean kind of 6 to 12 weeks after their initial positive test or after their symptoms, because we've got to remember that a lot of patients who had COVID in the summer probably were never tested, so they don't actually know whether they had COVID or not. And then if a patient ends up seeing a respiratory consultant, which a lot of these long COVID patients have done, then a respiratory consultant would want to do a number of different tests, lung function being one of them. And what lung function is it's when you essentially, it's a blowing test, and it looks at the amount of air that you can forcibly exhale, so that you can blow out in 1 second, and the total amount of air that you can blow out. And in some patients, we're finding that is reduced, but there's also a number of other lung function tests that can be affected as well, which looks at the diffusion capacity of the lungs. So what that means is the ability of the lungs to get oxygen from inside the air sacs within the lungs, called the alveoli, into the blood.
And for people who have had COVID, are recovering, I guess when's a good indication for people as to when they should be getting back into exercise? Like obviously you've just said rest, look after yourself, lots of hydration. When they're starting to feel better, what's a good indicator of
for people as to when they can start getting back into some exercise?
Yeah, this is a really good question, and one which I think is really, really individual to each person. And initially, when as a physio profession, not just respiratory physios, but as a kind of physio profession, last year when we first started seeing some of these patients, albeit virtually, completely virtually at that time, the thought process was, okay, well, kind of get moving. That's what we do as physios, isn't it? Kind of, get moving, and a graded return, prescribing a graded return to exercise, or a graded program. Now, actually, as time has gone on, we found that, and it's actually been driven by a lot of the physios who work with ME patients, that a graded return to exercise is not always the way to.
Sorry, and what's ME?
ME stands for myalgic encephalomyelitis. So it's like chronic fatigue.
Let's stick with
syndrome.
ME.
Yeah, chronic fatigue, or ME. Yeah, it's the physios that work with that cohort of patients that kind of turned around and said, actually, because COVID patients are presenting like long COVID patients, are presenting like chronic fatigue patients or ME patients, actually the way to treat them is not to prescribe graded exercise. So with that in mind, what that means is that what people shouldn't necessarily be doing is saying, okay, well, I'm feeling better, so I'm going to go and, I don't know, do a 2-kilometer walk. And then the following day, I'm going to do a 3-kilometer walk. And then the day after that, I'm going to do a 4-kilometer walk, etc., etc. It should very much be slowly, slowly, slowly. And the reason for that is because there seems to be a bit of a lag in terms of when patients are feeling fatigue. So they might think, okay, do you know what, today I'm feeling better, my symptoms are improving, I'm not feeling quite so breathless, I've got more energy, I'm going to go out, I'm going to go on a walk. And then actually the following day, or even the day after that, they're crashing and burning. And that is something that has been more and more evident as time has gone on. So although I think, a lot of patients who are getting COVID, or the ones that I'm seeing are ones that haven't been in hospital. They've been young, fit people who have kind of suffered at home, haven't had any medical interventions. They're all people that want to get going again, and they're quite motivated, and they want to get back to what they've been doing before. But actually, I think as physios, our role, or a large part of our role in this cohort of patients, should be, do you know what, actually you really shouldn't be overdoing it at this stage. You should be we're advising people to keep a symptom diary. So I know that sounds like a bit of a bore, but it's really useful in terms of patients writing down what they have been doing almost to the hour. I got up, I had a shower, I made some lunch, I did this, that, and the other, and scoring how fatigued that makes them feel. Because I'm talking to people a lot about the fact that we have a certain battery level, and we recharge like on our phone, and we recharge our phone overnight every night, and that recharges our battery. Now, what is happening with patients post COVID is that battery level is diminished before we even start, but normal activities like cooking, cleaning, washing is depleting that battery level a lot faster than it would have pre-COVID. So if you're then going and thinking about doing a 2-kilometer walk or whatever, like I mentioned, that's going to deplete that battery level even more, and it's going to take you a hell of a lot longer to recharge it. So there's no one size fits all. And I think if somebody is wanting to get back to exercising and they're not sure how, they should speak to a physio for some advice.
I think that's quite interesting because obviously normally for like a musculoskeletal rehab, if you've hurt your knee, then we'll sort of say, you know, do something 2 or 3 times, never increase more than 10% at a go, but you can kind of slowly progress like that. But actually, you know, thinking the fact that you might, you know, walk down the stairs and be breathless and fatigued. And so I had glandular fever really badly when I was little. I was like 18. And actually, I remember getting to the bottom of the stairs the first time I got out of bed. And no word of a lie, my mum found me asleep at the bottom of my stairs because I was exhausted. Yeah. And actually, if you're thinking about that battery analogy, kind of having the fact that all your normal tasks, loading the dishwasher, doing your, you know, dishes, all of that sort of stuff is depleting it. And then if you go out and do activity, then you're fatiguing yourself even more. Have you just taken yourself down, which has opened yourself up to other things anyway?
Exactly.
So you mentioned about a symptom diary in terms of fatigue. Would you get people to do that for breathlessness and things as well?
Yeah, sometimes. Although the breathlessness seems to be more clear cut in a lot of patients. So patients will say, you know, I get symptoms after I've been up the stairs, or actually I don't even have to be doing anything. I can just be sat watching telly and my chest feels tight and I feel like I can't get a satisfying breath and I can't get enough air. So yes, certainly. I sometimes say to people if they want to add in the breathlessness as well as a fatigue score, and it can simply be a score out of 10, like we'd call it a VAS, a visual analog scale in the physio world, which we use. I think all physios use that in some form, but it's easy for patients to understand as well. So a score out of 10 for either breathlessness or fatigue, and then we can look at patterns and think about how to increase exercise slowly, or should I say introduce exercise very, very slowly, and strategies to manage their breathlessness as well. I actually, and this is just my personal opinion, this is not based on anything, I think that the breathlessness as well contributes to the fatigue. Because if somebody is over breathing, and I'm talking more about, again, not the initial symptoms of shortness of breath, but if the way and the mechanics of somebody's breathing becomes affected in the longer term, then if somebody is working harder at breathing, I think that that has a direct effect on that battery level that we were talking about.
So it sounds like maybe gauging people like 24 to 48 hour response rather than the way you feel on the day of doing certain activities.
Yeah, totally, because there does seem to be this kind of post-exertional malaise, if you like. I think that's the proper terminology, or a crash and burn that is happening 24 to 48 hours later. And there's a lot of physios even, and I don't know whether you've seen anything on Twitter or used Twitter at all, but there has been physios that had COVID, felt better, went back to work thinking, yes, graded exercise, you know, this is the way that we normally do things, as any of us would have thought at that time. And then again, they just crashed and ended up in bed and back to square one and have needed loads of time off. So there really is this fine line of overdoing it, and I think it should be something that we as a profession tread very carefully with.
So if someone's kind of, you know, the initial 2 weeks sort of isolation, they've had a positive test, they've done their 2 weeks isolation, and actually they feel quite good, they don't really have any symptoms, what about getting back into exercise then?
Yeah, I mean, I think if they haven't had very many symptoms, they haven't had breathlessness, fatigue's not an issue, then I don't see why they can't start off slowly. I guess it depends what their fitness level was like before and how active they were before, because anybody having a period of several weeks off, I mean, you guys probably know better than I do, are gonna get some form of deconditioning and things. So I think, yeah, it depends how much they were doing before, and maybe start off with going out on some brisk walks or interval walks, stair climbs, things like that. some resistance work and see how they go. And again, I think if they find that they are doing what they would class a gentle workout and they're struggling, then that's a sign that, you know, they need to rein things back.
Yeah, and then by the sounds of things, then monitoring how that feels in the 2 days afterwards as well, because from what you've said, might feel absolutely fine at the time, but might be completely washed the next day.
Yeah, definitely, or the day after, Reece.
Yeah, so I think that's massively important. I'll definitely take home from this is keep that diary, that activity diary, so people, because no one's going to be entering at the same level, are they? So it's going to be very individualized for people.
Definitely.
And like anything, I guess start short of the mark as to where you think you should be if you're starting back with exercise, and because you'd rather be under the bar and work above it than start above it and end up below it.
For sure. And I think it depends what kind of, like we were saying before, what kind of personality that person is as well, because the danger is that if it's a person who likes to push themselves and wants to just go gung-ho straight back into it, it's somebody like that might need a little bit of coaxing or education really around why it's not a good idea to go straight back in, and could cause some damage.
Beautiful.
So final question. So if someone listening to this goes, okay, it's now been 12 weeks, so I've kind of got I've still got some symptoms, so I'm kind of coming into that long COVID phase, what should they do?
If they haven't, I guess it depends whether they've whether they went to hospital or not in the first situation, like in the initial stages, because some trusts, depending on where people live, would be under a follow-up team from a hospital anyway. So if it was somebody that went into hospital, they would probably have a follow-up from a doctor anyway. If it's somebody who hasn't, which is the vast majority of people, if they were just at home, the first point of call would be to go to your GP and say, I'm still having symptoms. The GP would then likely refer them on for testing for their lungs and their heart. So that's to a respiratory consultant and a cardiac consultant. And they would then go through those tests, and depending on those tests, that would dictate then that path of treatment. But it may or may not involve seeing somebody like myself, a respiratory physiotherapist, either from the fatigue and exercise tolerance side of things, if that was an issue for them, or the respiratory side of things for something like a breathing pattern disorder, if they're still getting shortness of breath.
Okay, so motto of the story is don't go onto Instagram and start following people's breathing exercises.
Yeah, I mean, you know, they're all done with good intent, of course they are. Everybody just wants to help, don't they? But I think there's a lot of things out there that aren't necessarily going to do you any harm, but I think aren't necessarily going to help. The best thing people can do is keep their lungs clear, not to panic. If they are getting symptoms of shortness of breath and they think they've got low oxygen levels, then get some help.
Good advice.
Brilliant.
Beautiful. Well, Em, thanks very much. As always, Helen, we've run well over what we were expecting to, but it's always great to get into chats with different people. Now, Em, if people want to get in contact with you, what's the best way to do that?
They can go on our website. Our website is www.airphysiotherapy.co.uk, or they can drop us an email at hello@airphysiotherapy.co.uk. We're on social media as well, Air Physiotherapy.
Excellent. That's Instagram and other channels as well.
And Facebook and Twitter at Air Physio London.
Fantastic. All right. Well, thanks, Em. That was really fantastic. Some great information in there. Again, as we said at the start, this first episode is very much aimed at patients, people who have had COVID. So we hope for everyone that's listening in that situation that this has been helpful for them. Episode 2, which will be coming up very, very shortly with Em, is going to be channeled more towards therapists. So I know personally, I don't know how many you've seen, Helen, but I'm starting to get a few come through. And it's just going to be nice to have some guidance for people in our situation as to what we should be doing with people, how hard to push people, where to start, those types of things. So looking forward to that chat next.
Thank you.
Thank you.
Thanks, Em.
Thanks for having me.
That concludes episode 16 of the Complete Health Podcast. For further information on the topic of COVID, particularly for the therapists listening, please listen to episode 17, which has been released in conjunction with this episode. As always, if you'd like to get in contact, please feel free to email in at either reece@complete-physio.co.uk or helen@complete-pilates.co.uk. We're also on Instagram with our handle being @CompleteHealthPodcast, which is all one word.
For another week, stay healthy and goodbye.